There's a lot of similarities between the elbow and the knee, mostly in documentation. So commonly you'll see knee flexion and extension documented as a single line, or you can document flexion and extension as separate lines, just like we saw at the elbow. Okay? Now, the one thing to get extension is you need to make sure the calf is not touching the table. That will artificially cause there to be a lack of full extension, so you need to put some kind of towel roll under the distal leg to make sure that the calf isn't up. So that's what I keep doing, is I'm just checking to see if I can get my hand to clear under her calf, and then I know that I have her leg up high enough. My guess is that some of you have crazy amounts of hyperextension at the knee because we had crazy hyperextension at the elbow, so I know there's going to be some people in here. So those people who have them as partners, you may need more than one towel to get the leg to clear. Okay? The alignment is not rocket science, which goniometry just really isn't, right? So we're going to, with the stationary arm, we're going to bisect her femur. If you feel more comfortable with the landmark, the greater trochanter is going to be where you're lining it up here. This is going to go along the joint line, and we're going to line this one up with her lateral malleolus. Okay? This one, it is really important that you get down at eye level. The biggest mistake I think I see at the knee is, one, that people don't have enough support under the leg, but two, the goniometer ends up being kind of anterolateral instead of lateral. All right? So the other thing that's a little bit unique about the knee, just like at the elbow, we can't just assume that they have 0 degrees for starting for flexion. You need to take the extension measurement first. Okay? Billy is at, it looks like, about 2 degrees of hyperextension. Okay? Now, what I'm going to do is have you, let's go ahead and have you lie back for me. And I'm going to have you come back and bend your knee as far as you can. Now, for knee range of motion, when you have the knee fully bent, please ignore the axis. All you care about is making sure that you get the alignment of your two segments. Ignore where the axis ends up. Okay? The knee is a joint, more so than at the elbow, where not only do you have a roll, you have a translation, and so the axis is going to move quite a bit when you flex the knee, so ignore that axis. So we have her at 140, of course, 48 degrees. Okay? Thank you. So if we were going to document this, now that was active range of motion. So if we've got zero objective range of motion, and I just measured Billy's left leg. So if I was going to do flexion and extension as one line, what would I write here? She had 2 degrees of hyperextension and she got to 148 degrees of flexion.
-2 to 148 degrees.
That means she started below 180 degrees, came up, and then went 148 degrees. Now the alternate way to write this, so or, okay, we could have left knee flexion and left knee extension as separate lines. So you wouldn't write all 3 of these in the same note. You would either do it this way or that way. What would we write for her? Oh my goodness. Active range of motion. Okay. What would we write for left knee flexion, active range of motion? What would we write here?
0 to 148.
Right. And what would we write for extension?
0 to 2.
0 to 2. Okay.
So based on that, if we pull knee flexion, are you expecting us to take the extension measurement too?
You have to, yeah.
Okay.
Because you don't know what your starting number will be for that range. You would only have half the info. So you're much better off pulling extension.
Yeah, I just wanted to make sure because you could document it just knee flexion then based upon the card.
Assuming, so you could do just this one, but you would still have to have this number. So you would have to assume that they're either at neutral or hyperextending, but you wouldn't know that without taking a look at it.
Wait,
Just in case they lack extension.
Yeah, so this is an example of someone who has hyperextension, right?
mhm.
So what if we said she lacked 2 degrees of extension instead?
2 to 148.
So here it would be 2 to 148 because she's starting, her starting position is at 2 degrees of flexion and she's going to 148 degrees of flexion. Okay? What about for flexion where we're only writing flexion?
2 to 148.
Good.
Now makes sense.
Now, in this scenario, the person couldn't get to 0, couldn't get to anatomical neutral, so what are we going to write here? Negative 2 degrees. And it's not a range because they couldn't even get to 0 to start moving into a range. They lack 2 degrees of extension. Okay? Everyone cool with that? Okay, so the documenting is the more difficult part than the actual measurement. Okay? It's consistent with what we did at the elbow.
Would you want us to write passive range of motion for extension?
So thank you for saying that. So it's tricky for extension as far as active range of motion. Can you have your pen back up for me? So typically we call active range of motion for extension simply this position. So we typically don't have them sitting on the end of the table and actually actively extending their knee. Okay? We consider this active range of motion. Passive range of motion of knee extension, ooh, I'm getting close. I would have to go up higher. I'm actually going to push down, okay, to get her passive extension. So if I was seeing someone post-surgically, the quadricep is one of the fastest muscles to atrophy, particularly post-operatively. And so people can have what's called a quadriceps lag, and so they have a hard time getting to end range extension. That would be the one time that I might have someone go ahead and sit off the table. And I might measure knee extension and now have you actively and have them do it this way. So in that one specific case of post-op, someone post-op for a knee surgery, I might do active range of motion like this. Typically though, you would measure them on the table like we demonstrated before. So if someone came to me before surgery, I wouldn't measure them this way, I would measure them the way that I showed you. Okay? This would be specific for me, only because I'd be thinking about quad lag and I would want to capture that I would measure it this way. Do you have any other examples where you might measure active extension in sitting? So you typically do it on the table as well. Okay. All right. So that's knee flexion and extension. So
Sorry, when they're on the bolster, you don't have them try to extend further at all. You just let them.
right,
And that's active, right?
right,
Okay. And passive's when you're pushing that.
right.
Okay.
So infants are going to have excessive knee flexion. Older adults, again, we're not going to see any limitations until over 80. You can imagine there's a lot of heterogeneity that's associated with age. Gender differences, again, that's a little bit controversial. If anything, women might have slightly more mobility in the knees. Again, we're going to see occupational and cultural differences. All right. So I think we've got three muscle length tests. So Billy, I'm going to have you slide back on the table. So the first one, you can sit up. Sorry, I know. Can you have your legs out straight for me? So the first one is just the sit and reach test. Honestly, it's used much more as a screening tool and not used in the clinic very much. You can read about much more details about it with norms provided in your Kendall text. Okay. So what I want you to do is keeping your knees straight. I'd like you to put your hands straight out in front of you, and I want you to try to reach past your toes.
Nice.
Wow.
Damn.
I'm impressed.
Okay, so this is an overall test of flexibility. You're finding out gastroc length, hamstring length, the one joint hip extensor muscles, and then also the trunk extensor length. So you're getting all sorts of measurements. So go ahead and come past again for me. So I'm putting the 1 inch here, and I'm measuring, and thankfully she's landing at 7 inches, so she's not going past my goniometer. So that would be plus 6 inches because she went past her feet. If she was short of her foot, that would be negative. So 0 is at the bottom of her foot. Okay? If you're short, you're negative. If you're over, you're positive. Okay? I also would never measure in inches. There are centimeters on this side, so she would have, and this has bad increments, so she would have been at 17.5. So 16.5 because oh no. Anyway, measure in centimeters. Right? Okay. Now you get to lie down.
Yay.
So, the last two, unless I'm forgetting something, are going to be hamstring lengths. So our hamstrings are 2 joint muscles, right? So it's crossing the hip and it's crossing the knee. So what is the overriding principle for testing the length of 2 joint muscles? What do we do with the first joint?
Shorten it.
Or lengthen.
Lengthen.
Let's lengthen it. If we're testing muscle length, we want to lengthen it at one joint. And then what are we going to do with it at the second joint? We're going to start with it short. We're going to start to lengthen it, and we're going to measure how far we can get. Right? What's it called if we can't fully elongate that muscle at the second joint?
Passive
Passive insufficiency.
insufficiency.
Great. You guys had me a little worried there in the beginning, I have to say. We haven't done muscle length testing for a couple of sections. So for the hamstring, what are our 2 options? So hip and knee. So what do we do? Pick something at the knee. What do?
Lengthen.
We lengthen it. So to lengthen the hamstrings at the knee, is the knee bent or straight?
Straight.
Straight. Okay. So then what are we going to do with the hip? We're going to
Flex.
flex it. Is it an active or passive test if it's muscle lengthening?
Passive.
Okay, cool. All right. These are the kinds of questions that will be on the written exam and considered cumulative. Okay, because these are principles we've applied all semester. Go ahead and relax your leg for me. Okay. So I'm going to do a straight, this is called the straight leg raise test. We're going to talk about the straight leg raise in the fall for some other reasons that we might do it. We're going to come up, this is a 2-person test. So you take the person until you start to see their pelvis come up or their other knee come up. You've come too far. Okay. And then I'm going to measure her hip flexion angle using the same goniometric techniques that we used at the hip. Okay, and I would document that. Someone got this, right? I thought I saw. Again. So we're still under objective. Now we're under muscle length tests, and we're doing hamstring. So we always list the muscle that we're length testing first. We're measuring the straight leg raise, and we measured left again, and we got 73 degrees in theory that I measured. Okay? It's not a range. This is saying that if this is at the point that either her other leg came up, or I saw movement of her pelvis, or you can feel it's going to be that muscular end feel. Okay? Now, what number do I want to compare this to decide if this is a limiting factor for her hip flexion?
You're back. Yeah.
So a range of motion test. Would it be an active range of motion test or a passive range of motion test?
Passive.
Passive, that I'd want to compare it to, and what motion?
Hip flexion
Hip
with the knee
flexion.
bend.
If her hip flexion is 0 to 73, and now I'm getting 73, that means her hamstrings are not limiting her motion. If she has 73 for this test, but her hip flexion range of motion was 0 to 110 or something, then I would know that her hamstrings are limiting her hip motion. Okay, Dave?
Do you do anything with the ankle with the test? Like have them point their toes up, or you just want it relaxed?
We want that. Right, we want that to be relaxed because we don't want to do that. We are going to get into that when we start doing neural tension in the fall. and use the straight leg raise for that purpose. For muscle length testing of the hamstring, we want to keep that foot loose.
Do you need to write that you measured at the hip?
The straight leg raise tells us that,
Okay.
okay, because you couldn't measure anywhere
okay.
else.
Okay.
But I like the way you're thinking. It's a better habit because a lot of you are forgetting that. I would rather you write more than less. Okay. The straight leg raise does tell us that that's what we're doing, but I would much prefer you did that than not. Okay, so that's one of our muscle length tests. What would be the other way to length test? So we've done one where we fully lengthened it at the knee and then measured hip. So what would be the opposite thing to do? Flex the hip and measure the extension at the knee, right? So we have a standardized test for this called the 90-90 test. So go ahead and lie back for me. The other leg needs to stay flat. Now, with the 90-90 test, we actually don't fully flex the hip. Instead, we put the hip at 90 degrees. Okay? So the reason this is called the 90-90 test is we have the hip at 90 degrees and the knee at 90 degrees. It's still a muscle length test, so it's still a passive test. So I'm going to go ahead. Okay? And this is how much range she has. All right? Now, again, this is a two-person test. You can ask the patient to hold it, but if they can't, you would have to have someone else come hold it and you would measure. Okay? Now, ideally, if she had full length of her hamstrings, where would she be able to get? To zero extension, right? Now, normal is actually negative 20. But what we're measuring is the lack of extension. All right? So this is always going to be a negative number. I've never tested anyone who's gone hyperextended in this test. Okay? So your goniometer is going to be aligned just like you would for knee goniometry. People are going to typically, Billy, be more like that. Okay? So then she would be negative 60 degrees, I happen to put it on. Okay, she wasn't that bad. But she lacks 60 degrees of extension, and that's what you would document. All right, so for this one, you would do hamstring, 90-90 test. Again, knee extension. And so then you get negative 38 degrees, or whatever your number is. Okay. And we have left indicated there. These are both measuring hamstring length, so you would not do both tests in the same patient. Okay, you would do one versus the other. I think the 90-90 test is probably more common if you're treating someone with a knee problem. The straight leg raise, I would say, is probably more common if you're treating someone with a hip or upper leg problem. It doesn't matter. They're both measuring the muscle length. Okay? All right, I think that's the last muscle length test. So the next is manual muscle testing.